Recording in progress. Start. Hello. Today's lecture is gram-negative route related to the animal sources, that is the zoonotic organisms. Now, the zoonosis are the human diseases caused by the organisms that are required from the animals. They are bacterial, viral, fungal, and the parasitic zoonosis. Some zoonotic organisms, they are acquired directly from the animal reservoir. Others are transmitted by the vectors like mosquitoes, fleas, and ticks. There are five medically important gram-negative routes that are significant animal reservoirs. Number one is Brucella species, in which we have Brucella melitensis, abortus, Brucella suis, and Brucella canis. The second one is the type is the Francisella tularensis, Yersinia pestis. Third, the fourth one is Pasteurella moltosida, and the fifth one is the Bartonella. The Brucella abortus is a gram-negative in the family of Brucellosia and is one of the causative organs of brucellosis. The rod-shaped pathogen classified under the domain of bacteria. Brucella abortus is non-spore-forming, non-motile, and aerobic. Cattle are the usual host for Brucella abortus. This organism causes brucellosis in bison, water buffaloes, camels, and elk, and occasionally affect the other species. Brucella is a zoonotic infections, and other name of Brucella are Andean fevers, Malta fevers, Gibraltar fevers, rock fevers, Mediterranean fevers. It occurs worldwide. The Brucella species are small, gram-negative aerobic cocobacilli. They are non-motile, non-capsulated, non-sporing, and non-acidic. The pathogens are the organisms they enter the body either by ingestion of contaminated milk product or through the skin by direct contact or occupational setting. They are localized in the reticuloendocrine systems like lymph nodes, liver, spleens, and bone marrows. Many organisms are killed by the macrophages, but some survive within these cells where they are protected from antibody. These are formations of granulomatous lesions with lymphocytes and epithelioid giant cells which can progress to form the focal abscesses. Imported cheese made from the unpasteurized goat's milk has been a source of B. melitensis infections. The disease occurs worldwide, but it can be because of pasteurizations. The milk kills the organisms. After the incubation period of 1 to 3 weeks, this is clinical manifestation. After the period of incubation period 1 to 3 week, 3 weeks, non-specific symptoms like fever, chill, fatigue, malaise, anorexia, weight loss occur. The onset can be acute or gradual. The undulating means rising and the falling of the fever patterns to give the disease its name occur in a minority of the patients. There is a large lymph nodes, liver, spleen are frequently found. There is a pancytopenia. Melitensis infections tends to be more severe and prolonged, whereas those caused by the abortus are more less limited. Osteomyelitis is the most frequent complication. Secondary spread from person to person is rare. Other clinical manifestations are fever, night sweat, malaise, anorexia, lethargia, joint pain, fatigue, weight loss, and depressions. The neurological findings may be meningitis, encephalitis, reticulopathy, peripheral neuropathy, and intercerebral abscess. And the cardiovascular problem, endocarditis, pericarditis, myocarditis. Pulmonary inhalations or hematogenous caused by any chest syndromes, rarely brucella isolated from the sputums. Clinical manifestation brucella genitourinary is epidermoorchitis, pyelonephritis, cutaneous is non-specific, hematogenic anemia, leukopenia, and thrombocytopenia. In the treatment, doxycycline, streptomycin, or rifampicin is added. Prevention is the pasteurization of the milk, immunization of the animal, and slaughtering of the infected animal. There is no human vaccine. In the laboratory diagnosis, the specimen, blood, urine, sputum, milk, breast milk, lymph node biopsy, and bone marrow aspiration. In laboratory method of diagnosis includes culture, serology, hypersensitivity test, and molecular test as PCR. Blood is a specimen of choice. Bone marrow and sometimes synovial fluid and periphery are also collected for the cultures. We called CDC utilized a test called Brucella PMAT, that is Brucella microagglutination test, a modern version of the serum agglutination test. There is no serological test available to detect the antibodies to B canis. We do PCR also, microscopy, no use, and serology antibodies, both IgG and IgM antibodies appears in the serum 10 days after the infections. Antibody titer of 1:160 is a presumptive evidence of Brucella infections. In serological tests, we do serum agglutination test, Rose Bengal test, ELISA complement fixation test, indirect COMS test, immune captured agglutination, prevention and control. Person handling the animal should be use protective clothing and gloves. Pasteurization or boiling of the milk, vaccinations, unimmunized infected animals should be slaughtered. Beobotus strain 11BA, a more attenuated variant of strain 19, has been widely employed for human immunization. Vaccine is given intradermally. Now, the second organism is the Pasteurella tularensis. Is a pathogenic specimen gram-negative Coccobacilli and aerobic bacteria. It is non-spore-forming, non-motile, and the causative agent of the Tularemia, the pneumonic form of which is often lethal without the treatment. That's the Tularemia. Tularemia or rabbit fever is an acute infectious disease of the wild rabbit, rodents, and human caused by the bacteremia called Francisella tularensis, also known as rabbit fever. The important properties are the small pleomorphic gram-negative rod. There are two biotypes, type A and type B. Type A is more virulent, while the type B is less virulent and found primarily in the Europes. It is transmitted by the inhalation and contamination, aerosol, or bite by the deer, flies, the ticks, and mosquitoes, or contact with the infected animals, eating undercooked rabbit meat, drinking contaminated water. Francisella tularensis causes the agent of Tularemia plague-like disease of rodent and other small animal. Epidemiology. The source is persist in the contaminated environment, insects, animal carriers. Has four clinical syndrome. One is the ulceroglandular tularemia, pulmonary tularemia, oropharyngeal tularemia, oculoglandular tularemia, typhoid-like illness, and bioterrorisms. This is oculoglandular tularemia and the oropharyngeal tularemia. These are the infections of the disease caused by this. The clinical findings are 75 cases are the ulceroglandular type. While the other less frequent form of tularemia include glandular, oculoglandular, typhoidal, and GIT and pulmonary, depending upon the site of the infections. Ulceroglandular is a local laceration at the site of infection. Oropharyngeal, sore in the mouth and throat, and well as abdominal pain, nausea, and vomiting, and ulcer in the intestine. Oculoglandular, swollen in eyelids, conjunctivitis, swollen lymph nodes, and ulcers. Typhoidal are the swelling of the lymph nodes and occasionally high fever, terrible headache, confusions. Pathogenesis. bacteria transmitted along the animal are by vectors such as ticks, mites, and lice, especially the dermacenter ticks that feeds on the blood of wild rabbit. The tick maintains the chain of transmission of passing the bacteria or its offspring by trans-ovarian route. In this process, the bacteria are passed through the ovum, larva, and lymph stages to adult ticks capable of transmitting the infection. Humans are accidentally dead-end hosts who acquire the infection, most often biting by the vectors, and rarely the organism is ingested an infected meal causing GIT, tularemia, or is inhaled and causing pneumonia. There is no person-to-person spread, and then it is localized to the cells of the conducive systems, and granulomas are formed. Caseation, necrosis, and abscess can also be occurred. Symptoms are caused primarily by the endotoxins. Diagnosis, treatment, and prevention we can do based on the symptom and patient history. Imagine a laboratory test is treated with antibiotics like glycosides, tetracycline, fluoroquinolone derivatives. Preventive measures include prevention, bites from the tick, flies, and the mosquitoes, ensuring well cooked meat, refraining from drinking untreated water, and using insect repellents. Also, a live attenuated vaccine available for individuals who are at high risk for exposure, such as laboratory personnel. The most frequent used diagnostic method is the agglutination test with acute and convalescent phase serum samples. Diagnosis skin lesion samples, staining, buffer charcoal, and yeast extract, serological test detect antibodies. Now, the third one is Yersinia pestis. It has got some endemic spread. The first endemic spread was the plague of Justinian, 542 to 750 AD, severely weakened the Eastern Empire, the Roman Empire. 25, 50 million deaths were occur. 25, 30% of empires, 5,000 deaths per day in Constantinople. In type 2 pandemic, it is also known as Black Death, which starts from 1346 to 1353 AD. Devastated Europe, 50 million deaths, 60 million percent of European population. In pandemic 3, in China and worldwide 1855, 1959 AD, mostly in China, India, and Asia, spread globally in 1894 from Hong Kong, or 15 million, about 15 million deaths. Is a plague disease caused by the Yersinia pestis. The natural host for this organism is a rat, and the disease is usually transmitted to women through a flea bites from the flea that has fed. Yersinia pestis is an anaerobic gram-negative, non-motile Coccobacilli bacterium without spores. They are also catalyst positive, oxidation negative, and glucose fermenters. This is a rat flea. Now, the main species are Yersinia pestis, which causes an infection called Yersinosis, and Yersinia pseudotuberculosis causes pseudotuberculosis in animal, and Yersinia enterocolitis enteritis in man and animals. Mode of transmission: the infected rat flea, direct contact tissue of infected animals, Doppler pneumonia plague, bite by infected human flea. Pathogenesis: when the flea feeds on rodent infected with Yersinia pestis, the ingested organism multiply in the guts of the flea and helped by coagulus block its proventricularis so that no food can pass through. The block and the hungry flea bite ferociously and aspired the blood contaminated with Yersinia pestis from the flea is aspirate is regurgitated into the bite wound. Inoculate organisms may be phagocytized by the polymorph nuclear cells like neutrophils and monocytes. Organs are killed by the polymononucleosides, nuclear cells, but can multiply in the monocyte because the bacteria are multiplying at 37 degrees. They produce antiphagocytic protein and subsequently able to resist phagocytosis. The pathogen rapidly reaches the lymphatic, then tests hemorrhage, inflammation develops in the large lymph nodes. They undergo necrosis and becomes flatulence often reach, bloodstream becomes widely disseminated. Hemorrhagic and necrotic lesions are developed in all the organs. There is meningitis, pneumonia, pleuropericarditis are prominent features. After incubation period of 2 days, there is a high fever, painful lymphadenopathy, commonly with great enlarged tender nodes, the groins and axilla. Vomiting, diarrhea may develop early steps. Later, DIC leads to hypotension, altered mental status, renal and cardiac failure. Terminally, signs of pneumonia meningitis can appear. Yersinia pestis multiply intravascular and can be seen in the bloodstream. They occur in three forms: bubonic plague, pneumonic plague, and septicemic plague. And in bubonic plague, there is a bubone in the groin, that is swelling in the groin, glandular swelling, tender inguinal lymph nodes, rat flea bites on the legs, fever, chill, malaise with bubo, incubation period 2 to 7 days, mortality 30 to 90%. And bubonic plague, most common type transmitted by the bite of infected flea, rat flea, and bacilli, passes from the lymphatic system. Sudden onset of fever, malaise, headache, and painful lymphadenopathy. Bubu regions they are the regional lymph nodes, tense, tender, swelling bubus. Common site is inguinal regions, and other sites are cooler region, axillary, cervical, or axillary. Cannot spread from one person to another. Without treatment, disseminations occur leading to pneumonia and meningitis. Pneumonic plague, the second one is pneumonic plague, more dangerous variety, virtually always fatal, most fractures involve lungs, hemorrhagic pneumonia, and short IP. Primary pneumonic plague inhalation droplets, incubation period is short, is 1 to 3 days. Clinical findings, sudden onset fever, headache, productive cough, ptosis, dyspnea, chest pain, highly infectious and fatal. Pneumonic plague is spread with inhalation of bacilli in droplets. The incubation is 1 to 3 days. If it is not treated, the bacteremia and the incubation take place 2 to 7 days. Blood vessels involved, hemorrhaging in skin and mucosa, and the gangrene of the infected area. It is also known as black death. That septicemic plague, secondary septicemic plague, more common than the primary one. It is also known as the black death. There is a hemorrhage in the skin and the mucosa and the gangrene of the affected part. Septic. Bubonic plague aspirate from, we take a specimen, aspirate from bubus, or that is a glandular swelling, sputum, blood, splenic aspirates can also be there. In the specimen, we take blood for culture, aspirate of enlarged lymph nodes, acute and convalescent sera for antibody levels, sputum for culture, CSF for smear and culture. Smear examine under staining, Gimza staining with specific immunofluorescent stain. Culture on blood agar, McConkey agar, and infusion broth. Definite identification is best done by the immunofluorescence. All the cultures are highly infectious and must be handled with extreme cautions. And the serology, we take convalescent serum, antibody titers of 1:160 or greater is a presented evidence of infections. Besides, we do X-ray test to see the pneumonic changes in the lungs. Vaccination or only for the bubonic, killed, virulent, formalin fixed. Egg vaccines are available. Future production licensing unknown. Three primary doses are there. Booster point to at 6 months. Prevention, vaccination, indication, lab worker with fully virulent strains, military persons we are stationed in the endemic areas. Adverse effects, significant numbers have mild reactions. Kerosene oil should be sprayed over the carcass to kill the flea. Boo-boos are present in the cervical regions. Boo-boos, liver, skin are processed like clinical samples. We give aminoglycoside, streptomycin, and gentamicin, and chloramphenicol. Chloramphenicol. This is and the Pasteurella harbor respiratory tract of many animals. They are Pasteurella multitoda and Pasteurella hemolytica, Pasteurella pneumotropica. The non-motile gram-negative facultative anaerobe Coccobacilli with bipolar staining causes chicken cholera and hemorrhagic septicemia in various animals and birds. Most important species include P for Pasteurella, P multitoda, P pneumotropica, P aerogens, P dagmatis, P canis, and P stomatitis and cavalier. Multitoda is non-motile gram-negative anaerobes, rod or bacilli, non-spore forming encapsulated in culture, oxidase and indoor produce positive urine test. Infections of respiratory system. It also causes systemic infection, including meningitis in immunocompromised patients. Human infection include wound infection, characterized by rapid development of the pain, erythema, swelling, cellulitis with or without abscess, for my bone and joints. Infection also occurs. Liver disease occurs in immunocompromised host. Specimens are swab from the wound, CSF, in case of meningitis and secretion of sputum in case of respiratory infection. Direct microscopy with gram staining, culture on the blood agar and McConkey media or agar. Okay, biochemical test. Treatment. Give penicillin G for pasteurella multiphoda infections. Bartonella. Bartonella is a gram-negative intercellular facultative bacteria that is commonly implicated in causing zoonosis infections. It is also known as trench fever, or also known as the 5 days fever, was first reported in Europe with soldiers. Trench fever is transmitted by the body loose and is non so excessively occurs in the humans. They are transmitted by the vector called ticks, flea, sandflies, and mosquitoes. They are facultative intercellular parasites are capable of living and reproducing each either sides or outside. Uh, 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 Several species of Bartonella bacteria cause disease in the people. Infection with any one of these bacteria referred to broadly as Bartonellosis. Although some forms of the infections are also known common names, for example, cat scratch disease. Bartonella pointana, Bartonella vinceni, and Bartonella washingtonensis. These are different reservoir vectors of the Bartonella. Symptoms: fever, headache, fatigue, poor appetite, pain, muscles, and swelling glands around the neck and palms. Hensley, Bartonella Hensley, the facultative intercellular small organism, negative microorganisms. It is bacteria that is causative agent of cat scratch fever, cat scratch disease, and the human infection muscular endothelial system. Cells like monocytes, macrophages are infected. Cats can have flea that carry B instead of bacteria. These bacteria can be transmitted from the cat to the person during a scratch, and it's contaminated with a flea stool. Is a flea. Symptoms are of the cat scratch are swollen lymph nodes near the side as bite of the scratch, fever, headache, fatigue, and poor appetite. The skin postulates. The lab diagnosis, serological testing, culture, histopathology, and PCR. Bartonella pestis, positive agent of Oria fevers, acute febrile illness constituting severe anemia. It causes Oria fever transmitted by sand, fleas, and the incubation period 3 weeks to 3 months. These nodular may become secondary infected, producing ulcers. This condition is known as verruga perona. Prevention and control. Avoid bites and scratch kittens. Wash wounds immediately. Flea control. Clip nails. Keep cats indoors. Antimicrobial. The severity of Bacillus not usually specific is known. Susceptible to 70% alcohol, 1% sodium hydrochloride, and formaldehyde. Thank you very much. Ali, just stop sharing. हाँ, stop sharing. और